Auscultation of abdomen. The last step of the abdominal examination is auscultation with a stethoscope. With the patient supine, diaphragm of the stethoscope should be placed on the right side of the umbilicus to listen to the bowel sounds, and their rate should be calculated after listening for at least 2 minutes. Auscultation of the abdomen is performed for detection of altered bowel sounds, rubs, or vascular bruits. Normal peristalsis creates bowel sounds that may be altered or absent by disease. Normal bowel sounds are low-pitched and gurgling, and the rate is normally 2 to 5 per minute. Absent bowel sounds may indicate paralytic ileus, and hyperactive rushes or borborygmy are usually present in small bowel obstruction, and sometimes might be auscultated in lactose intolerance. Diarrhea is associated with increased bowel sounds. The intestinal obstruction produces a classical, tinkling bowel sound like water being poured from one cup to another. The diaphragm should be placed above the umbilicus to listen for an aortic bruit. The presence of the aortic bruit indicates an abdominal aortic aneurysm. The diaphragm should be placed above the umbilicus and then moved 2 centimeters above and lateral to the umbilicus to listen for a renal bruit. The presence of the renal bruit indicates an renal artery atherosclerosis. If there is a clinical suspicion of delayed gastric emptying, a maneuver that is sometimes uncomfortable for the patient may be performed. The examiner should place the stethoscope on the abdomen and hold the patient at the hips and shake him from side to side. If splashing sounds, called the Succussion Splash, are audible, the test is positive. The presence of an abdominal venous hum is virtually diagnostic of portal vein hypertension, which statistically is secondary to cirrhosis of the liver. If the venous hum radiates or is confined to the chest, it may be mistaken for or obscure a murmur of cardiac origin. A friction rub over the liver is indicative of cancer in the liver, with inflammatory changes or infection in or adjacent to the liver. If detected in a young woman, the examiner should consider gonococcal peritonitis of the upper abdomen and Fitzhugh-Curtis syndrome. Friction rub over the spleen suggests splenic infarction. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.